For diagonal 1, or D1, extension and flexion with the patient's elbow extended or straight, one hand should support the upper arm and the other grasp the patient's hand to control the patient's wrist and hand. Make sure that the elbow remains extended throughout the movement. The patient's hand moves in a straight line from the starting to ending points. For diagonal patterns, movement begins with the distal component and progresses proximally until all segments are moving simultaneously. Note the position of the therapist and how he shifts his body to permit the movement to occur. D1 flexion with elbow flexion also begins with the patient in the supine position. In this case, the therapist uses one hand to support the upper arm while the other grasps the patient's hand. When performing the range of motion of the patient's right upper extremity, the therapist's right hand controls the patient's wrist and hand. Note that as the shoulder flexes, the elbow flexes, and as the shoulder extends, the elbow extends. Note the position of the therapist and how he shifts his body to permit the movement to occur.